Guys are in for a treat. It is the first book ever that fully connects the dots between sleep apnea, snoring, teeth grinding, chronic pain, fatigue, to a mouth that is too small to hold the tongue, and what you, as health caring doctors, to help your patients redevelop that 3-foot cage to improve airway, sleep, energy, to get well and stay well. Will you please put your hands together and welcome Dr. Felix Liao.
Thank you, Marvin. Appreciate it. Thank you for coming. I have lots of material. Some of you have the syllabus already. If you have any question about a slide, write down the slide number and contact me. Okay. Lots of material. I'm gonna let my slides do the talking rather than myself do the talking. I'll simply explain the slides. So some of the slides will read like movies. So here we go. Fasten your seatbelt. When you leave here, you will know more than almost anyone else. And my goal is for you to take one look at your patient in front of you or yourself and say, I know you've got 6-foot tiger in a 3-foot cage and suffering the consequence of it. Okay, here we go. How many of you snored last night or slept with someone who did? Okay. We know the prevalence is high, impaired mouth syndrome. Okay? Now, snoring is not benign. If you snore more than half the time, you have twice the risk for stroke. If you snore full time and you have sleep apnea and obesity, you have 8 times the risk for stroke. Okay? I would rather have cancer than stroke. Just for the record. How many of you wear an eye guard or should wear an eye guard or grind your teeth? Okay. This is not benign either. Okay. Teeth grinding is now sleep bruxing, and I propose that sleep bruxing is an airway disorder. I'll show you evidence for that. Okay. So every typical eye guard a dentist prescribes is a missed opportunity for airway evaluation. When you leave here tonight, like I say, I would like you to know that one look and you can tell. Here's an example. Arterial blood pressure rises 20 to 25% with sleep bruxing. Now, that means that sleep bruxing is associated with a what? Stress event to the body, correct? Okay, that's why your blood pressure rises. Okay, we'll find out why, but I just want to pique your curiosity. Let's connect the dots. Okay, your patients have medical symptoms and they have dental disorders. How often have you connected the two? How often have you had your medical symptoms and your dental symptoms connected together and explained it back to you? For my patient, they said never. Okay, so let's see if we can do that. I want to introduce a new term called holistic mouth. A holistic mouth is one that supports whole body health. Okay, an impaired mouth is like a drunk driver. You can drive, but you're a road hazard. So impaired mouth is a health hazard. How? When everything is squashed here, this is a flat facial profile. Here's a convex facial profile. It would have a wide airway, and this one would have a narrow airway. You just picture all the furniture in your living room pushed against the back wall. There's no space in between your furniture for you to walk through, and here you have no airway for oxygen supply. Okay? So this is the difference between a holistic mouth and an impaired mouth. It results in their airway. Stress shows up in the mouth in a big way. Don't let anybody kid you. The first thing we do is do something with our mouth when we're stressed. How many of you reach for dark chocolate? Or yell and snap, lash out? Okay? In the House of Representatives, in the brain, the number of neurons that are devoted to the parts of the body is called a homunculus. In our brain, we are preoccupied with getting the mouth fed with our hands. These are serious multitaskers. That's why so many neurons are devoted to this, to these two parts here. Okay? The rest of the body is relatively simple to command and control. So, is your mouth or your patient's mouth a health asset, or is it a defective infrastructure? Okay? If it's an asset, it would be able to do alignment, breathing, circulation, digestion, energy, and sleep with ease. It's perfectly able to handle all of these tasks. If not, it's a defective infrastructure and it will lead to all these symptoms. Very simple. Okay, so a holistic mouth, I define it as, it's a term I coined, and it's defined as a structurally fit to support whole body health through these functions. Is that clear so far? How am I doing? Okay. All right. So here's one case.
My husband has sleep patterns to where he can seemingly be sleeping very soundly, and then all of a sudden it's like he's strangling, and he awakens about every 20 minutes just almost in a panic, and sometimes he's able to get back to sleep, and sometimes he has to get up and kind of walk away from it, and it's concerning, and it's definitely affecting our lives and how we both feel the next day, that we are more tired when he goes through these cycles, and we're very much looking forward to having healthier, happier sleep, so that we can have more energy in our days, because it's not just him who's having the effects, it's also myself, because I'm directly affected by his sleeping patterns at night. And my name is Karen, and I give him permission to utilize this video for the use of helping other patients.
So I like treating snoring because you don't just help one person, you help two. And maybe the whole family, because the mom is always the center of the family, right? Okay. So this is her husband.
Hi, my name is Dave, and I've been using Dr. Liao's oral appliance for 3.5 months. I came to Dr. Liao. I've been suffering from back pain for most of my life. I've been to many chiropractors, nutrition specialists, and so forth, and I never really seen any kind of real relief. But now, with using this appliance, top and bottom, for 3.5 months, my mouth has expanded quite a bit. My lower teeth are no longer crowded. My airway has opened up, at least I think the last CT scan we did, the updated one, was about 70% improvement. And my lower back pain is almost non-existent. So I get permission for Dr. Liao to.
Okay, you get the picture. So that's him in profile. This is called Liao's sign. It's not because I'm so enamored with my own name, but you're going to see this over and over again in your patients who have trouble responding to treatment, be it medical, dental, or otherwise. Okay? This is a serious health blocker. This is defective infrastructure. Inside this mouth, he had tongue tie. Inside this mouth, he's got a 6-foot tiger in a 3-foot cage. And therefore, he has sleep apnea with an AHI of 36. Sleep apnea is measured by the number of times you stop breathing for 10 seconds or longer in an hour. So, every one of you, zip your lips right now and pinch your nose. Here we go. Okay, you can let go now. How many of you are glad that you could have that next breath? When you have AHI, you couldn't get that next breath. And he had that experience 36 times an hour, every hour. Okay? So this is what impaired mouth does. Okay? You can tell impaired mouth by simply looking at the patient in profiles to see if they have this thing called Liao's sign. Okay? So I wrote a book called 6 Foot Tiger, 3 Foot Cage, and we distinguish between impaired mouth syndrome, which is the result of having this defective jaw as an infrastructure to support alignment, breathing, circulation, digestion, energy, and sleep, A, B, C, D, E, S, okay? When your mouth cannot support those functions, they will result in these symptoms. And I recommend that you get a copy of this book, put it in the office, or tell your patients to go find it on Amazon, and they'll come looking for you and say, can you solve these problems for me? And you can see from the previous case, yes, you can. But you cannot come from the mindset of a biological dentist. You must come from a mindset of a, what I call holistic mouth doctor. A mouth that can support all of these. Okay? I would just add one other thing here. Many of these symptoms are simply a reaction, a consequence of having a 3-foot cage. It turns out that now you can redevelop that 3-foot cage. Okay? So once again, this is your sign number 1. When you look at their patient Monday morning, you're going to look at it in profile and say, you got Liao sign. You got impaired mouth. Let's take a look to see if your inside is like this. Okay? How do you read this color scale? White means that your airway is wide enough that it's not going to collapse during sleep and that your oxygen supply is not going to get interrupted. The more your airway volume tends towards the red zone, the more you suffer the dry form of waterboarding every night when you sleep. These people, once they get sick, they never get well because they're struggling to stay alive every night. So when that happens, you will have adrenal burnout. You can try to do all the supplements and functional medicine, but as long as you have this every night for 8 hours at an HI of 36 or more, you're going to have problems. And that problem is going to happen as long as this exists. So Liao sign, when the lip is curled, upper lip is curled like this, or it's flat in profile, it means that the maxilla is retruded, mandible is retruded, because this is not going to give, the spine is not going to give what's going to happen to this airway. It's going to get squeezed, pinched, okay? So I traced out a CT image, and this is what happens. This is called the oral pharynx, the space behind the tongue. The nasal pharynx is the space behind the soft palate. Okay, when those things are blocked here, you're going to have susceptibility to obstructive sleep apnea. And these are the systemic consequences of obstructive sleep apnea, which, by the way, is a relatively new science, new area of inquiry. He's considered the father of sleep medicine, William Dement, and his seminal paper came out in 1993. Okay, we're barely 20 years old. It took dentistry 30 years to teach dentists how to do mandibular block. So you get an idea how young this is. But in his paper, there is no sleep bruxing, there's no oral facial complication. He just focused on the medical aspect. There's a dental side to this. Okay? So, I call this medical, dental, mental, and financial consequences of impaired mouth structure, impaired mouth syndrome. Okay? And it harms the whole body more than you know. And I invite you to become a impaired mouth investigator and see if this is the case, this leads you to this. And then this to that. Now you know your role in how to solve the airway part of these leading causes of death. If you're choking in your throat and you don't have oxygen night after night, you're gonna have these much faster, irregardless of salt, sugar, fats, whatever other additives or environmental toxins. What's the easiest way to kill someone? What's the fastest way to get someone anxious? Cut off the air. Okay? So I hope to help you grow some new eyes so that you can see how the impaired mouth produces medical troubles on one side and dental troubles on the other side by putting the mouth back on the body map. Okay, so let's see a real case. What's this? Medical doctors in the audience. Staring you right in the eye. This is a surgical stent for a cerebrovascular accident. This patient had a stroke right at sella turcica area. Okay? So, what's her airway like? Maybe if you know this ahead of time, she wouldn't have to have this. Is it possible? And this happened under her dentist and her doctor's watch. By the way, the ideal airway should be 12 to 17, and she's got 3 millimeters at the narrowest. This is her occlusion. Okay? Serious crossbite. Her maxilla is seriously underdeveloped and retruded. Okay, her midlines are off. The dental midlines are off, her neck is going to be off, and she will have uneven vertebral artery supplies to the brain. Spotlessly clean. Perfect dental hygiene checkups at recall time. But it happens right under the dentist's eyes that she had a stroke. Okay, look at her neck, uneven. Look at her spinal midline and her dental midline. She's got a steep mandibular plane angle. Okay? This is all new eyes that dentists who are now going to be trained as holistic mouth doctors can pick up, even without a CT scan. You can look at somebody in profile, you can pick this out very quickly. Look at the jawline. Okay? So what are your patient's most frequent complaints? Name a few. What's the top one? Sensitivity, yes. Next. Headaches, next. Fatigue, chronic pain, insomnia. Okay? Those are the most common ones. Those symptoms drive the patients to the doctors. And often they don't get to the source of the problem. Okay? So I put together the oral and the systemic signs and symptoms. I put it into a table called the impaired mouth score. You can use this as a conversation once you picked up impaired mouth features like Liao sign, and I'll show you some more later. Once you have that, you can give them this to fill out. And you look at what the total score is. It's a conversation starter. Okay? Teeth grinding. How many dentists are here? Okay, how many non-dentists are here? Okay, great. We prepared this thing for you both. Okay? So teeth grinding is now sleep bruxing. Why? Because it happens only in sleep. Bruxing means it's a Greek word for grinding together. What is the cause? Dentally, for the dentists in the audience, what percentage of your patients grind your teeth? Just throw out a number, yeah, out loud. 80% I heard? 40? Anyone else? 70? Okay, whatever it is, it's not a small number, is it? A significant percentage of our population grind their teeth, okay? I would say that the higher that number you throw out, the more you are aware. Those who say 40, grow some new eyes and you'll come back with a higher number, okay? So I would just give you my conclusion. I think teeth grinding is self-administered CPR. How do you do CPR? You thrust the mandible forward, right? And then you clear the airway before you do mouth to mouth, okay? So that's what the body does. It thrusts the mandible forward, but the teeth are in the way. So guess what? I need oxygen. I'm going to choose teeth or oxygen. Get the teeth out of the way. Give me oxygen. All right? So when there's an airway obstruction, I think it's the body's reaction to the airway obstruction that the teeth grinding is initiated. And there's evidence for that, and this is not enough time for me to go into depth for you. For you non-dentists, this is a picture of something that we dentists, when we see it, we shake our heads, okay? Cracked teeth. There is no solution to save this thing, okay? You have to take out this tooth. And in this patient, these two teeth are their opposing teeth. She killed two teeth with the same amount of grinding night after night. So teeth grinders often suffer these symptoms. And dentists who are aware, dentists who are holistic mouth doctors, they would be able to connect these symptoms to teeth grinding and then back to the airway. Medical doctors who are aware would ask their patient, do you grind your teeth? Do you have a night guard? If you do, and you also have these symptoms, maybe we should get your airway checked out and your jaw structure evaluated by a dentist who is trained as a holistic mouth doctor, okay? Journal American College of Cardiology. OSA is responsible for 50% of the hypertension cases. 1/3 of cardiologist's office has got heart attack patients. 1/3 of that is responsible from OSA. 60% of stroke comes from OSA. This is serious. Okay? And impaired mouth syndrome contributes to OSA, bar none. Okay? Brain fog. How many of your patients complain of brain fog? Lots. Okay? Here's an Alzheimer's brain. Here is a normal brain. What kind of fuel does the brain run on? Oxygen and glucose. When you're sleeping, are you eating? No. You're operating on oxygen. Okay? The maxilla has a big part in brain health. Well, this is one of the first studies that's ever done. Among elderly women, those with sleep disorder breathing have an increased risk of developing cognitive impairment. Adjusted odds ratio is twice. Okay? So when you have airway obstruction, you're more likely to get Alzheimer's. Okay? Why? Because you're oxygen starved. Next, depression. How many of your patients have depression? I know I have many. If you ask them, they'll tell you. Okay? People who have problems with sleep are at increased risk of developing emotional disorder, depression, and anxiety. Okay? So sleep is the first way to fix depression. In fact, I would say sleep is the first thing you would improve to heal anything. So holistic mouth solutions means that dentists are in touch with the patient's medical symptoms and physicians are in touch with the patient's dental symptoms. And both groups are mindful of the patient's sleep and airway. Okay? For good sleep and high energy the next day, all 4 zones need to work. What happened is that when this space is too small, the tongue doesn't get smaller, does it? And so this space gets taken up. How many of you have had teeth taken out for braces? Raise your hand. You just had this space taken down by 14%, but your tongue did not get reduced by 14%, did you? So you would have automatically a narrower zone 3. Okay? On top of that, your upper jaw was too narrow in the first place. That's why you needed braces. Now they just took out more teeth and you have a smaller zone 2. Okay? All right. Who's going to win? You now know. The one with the bigger jaw, Floyd Merriweather. This guy. He is way better developed here. He's got a much wider airway in the back. Okay? So I tell you this because it's not just about sleep and health and breathing. It's about appearance. It's about a career. Okay? This is the bone we're talking about, the maxilla. We're not talking about mandibular advancement devices like the tap appliance. I have nothing against that. But the maxilla is underdeveloped all too often, and the mandibular advancement devices does not begin to address that issue. I didn't put in a slide, but I'll give you a number you might want to write down. This is called maxillary retrusion. That means it's positioned closer to the cervical spine. Liao sign means 50% of the people have maxillary retrusion. You see that at least 1 out of 2 people. Okay? All right. Well, arrow went in the wrong direction. Okay. There is a good reason why form and function led him to the richest contract in Nike history. When you have a wide jaw, this is the same person, by the way. You can see it from here, okay? When you have a wider jaw, you have more room for your tongue, as opposed to you when you have a narrower jaw, right? Okay? Where does the facial radiance come from? Plastic surgery and orthodontics didn't exist back then. Okay? She came as is. Okay? Okay? Where does facial radiance come from? Does it come from genes, jaws, or airway? All of it. Yeah. But if your jaws is maximized, so is your gene, so is your airway. Okay? Form and function. Better form, better function. Lesser form, lesser function. Who's going to wake up more tired the next morning? You know now. Okay? How do we get a narrow jaw to go from here to here? This is my own case. Okay? It's called DNA appliance. That's one option. It's not the only option, but it's an option, specifically for this purpose. Okay? When you turn the key in the direction of the arrow, the edges opens up, and it provides a stimulus for the jawbones to start redeveloping as if you were a teenager again, regardless of what age you are. This is called epigenetic orthopedics. That means that no matter how many years you've gone past your growth spurt years, your jaw can regrow. And we can stimulate it. This is my own case. I'm in my mid-60s. I started out with an airway of 13.1 cc because my maxilla was a little small and my mandible was class 2. Okay? Right now, my airway is 28.2 cc, more than twice the volume, because I expanded my upper jaw so that my mandible can come forward. So the upper jaw is like the shoe, the lower jaw is like the foot. Which one should be bigger? Okay, what happens when the shoe is too small? The mandible has to retrude. So it's like trying to fit your foot into a clog that's 3 sizes too small. The heel is left hanging out. And when that happens, you're going to have this. Make sense? Okay. So right now, this is where I started. I had moderate obstructive sleep apnea before I started. Now I have almost none. My AHI is 6.2. 5 or less, they consider you 0. Okay? So this thing works no matter what age you are. Okay? And impaired mouth leads to sleep apnea, teeth grinding a whole lot more. If not you, who's going to prevent this? If not you, who's going to detect this? And if not you, who's going to reverse this? So I want to go over a few other features that you can recognize and corroborate your initial superficial observation, okay? So I know the bathroom is going to be crowded when you leave here because everybody's going to be looking at his or her own uvula. If you cannot see your uvula like this, you're high risk for sleep apnea, okay? A group of Spanish physicians, ENT doctors, made this observation so that those of you who do not have access to a CT scan, you can basically pick this up, okay? You just say, open the mouth and keep your tongue inside your lower arch, as wide as you can, see if you can see the uvula, okay? Here's another one, crenation of the tongue, tooth prints on the sides, okay? It's 70% specific for OSA. Your sleep efficiency is going to drop, meaning that the amount of time you're asleep versus the time in bed. You have a harder time falling asleep. 6-foot tiger, guess what? Undersized cage. Very crowded lower front teeth is always a sign of the shoe being too small for the foot or the maxilla is underdeveloped. Okay? Look at this. Tooth print on the side of the tongue. Lower oxygen delivery and lower sleep efficiency. That patient is always going to wake up feeling like I didn't sleep enough. Okay? Higher OSA risk for mandibular tori and sleep bruxing airway disorder. Here's a case. The patient comes to me and say, I broke a tooth. Came in to see me on a Saturday. I took one look. We're doing some crime scene investigation now. Okay? I look and I say, geez, you got these big humps in here. They're called lingual tori. Tori means bumps. Okay? Why are they there? Because this patient has been clenching and grinding for all his life. Can you see the wear for set here? I suggested him do a CT scan, and sure enough, he's got an airway that's less than half of what it would be. This guy's a gym rat. He's a hunk. He's a fitness enthusiast. Dr. Singh, the inventor of DNA appliance, published an editorial that I think was an elegant theory that says that this is indicative of undiagnosed sleep disorder breathing. Why? Because the patient clenches and grinds their jaw. Clench the jaw and grind their teeth. I want you all to do this. Take the whip of your thumb, frame it around your earlobe so that your palm sits on your cheek and your fingertips are on your temples. Okay? Squeeze. Squeeze your jaw tight. You feel those muscles bulging? When those muscles contract, the superior constrictor or your throat opens up. Why? Not just so that you can swallow. And this is the result of the body utilizing the first half of that swallowing mechanism to open up the airway. It's a compensation. And this is the evidence at the crime scene that the jaw is being clenching, the body is suffering from airway deficiency. Okay? So this patient with a broken cusp, I tell him you got bruxing, you cannot see the uvula, you got an airway that's in the red zone. I sent him for a sleep test. He had undiagnosed obstructive sleep apnea. AHI was almost 20. Okay? Medical diagnosis, moderate obstructive sleep apnea. Guess what happened? He had a heart attack one morning when he was biking to work. Okay? By the way, when does heart attack happen most often? 6 to 9 a.m. Why? They've been struggling all night with that. Okay? So this is under your watch. When you're oral systemically aware, you can connect the dots. So this patient was nearly bankrupt from trying to fix her Lyme disease. Find answers. Okay. Look at her. Does she have Liao sign? Look at her airway. How can you recover from this? When you have a cold, what do they tell you to do? Go to sleep. Right? You should feel better when you wake up. Well, the patient with an airway like this does not have a chance to get better. This affects your immune system. This affects your energy production. This will keep you sick and tired. So this is the problem. You have a 6-foot tiger and you have a pinched airway. It's 90% undiagnosed back in 1993, and the same researcher did a study 18 years later, or 15 years later, and still 75% of sleep apnea is not diagnosed. The signs are everywhere. We just need to grow the new eyes to make the connection for the patient, okay? Because we are surrounded whenever we're in traffic by people who didn't sleep well the night before. This is a sleep medicine solution, okay? It's highly unacceptable to most patients who have come to see me, okay? I don't make this up. I think CPAP can be a lifesaver in certain cases, and I've told some patients, look, you should be on CPAP for a year before you come to see me, or 6 months. And then let's reopen the conversation, okay? But CPAP does not fix chronic pain. And you saw in my first patient that it has the ability to fix chronic pain, okay? Here's one patient. This is the first week.
Hello, my name is Robert. I'm from Stafford, Virginia. And I've had about a week's time now with the DNA appliance. I wear both the upper and the lower piece. I had been using CPAP in the past, didn't care for it at all. Did get some relief from my sleep apnea, but I do prefer the DNA device. Less care as far as the hoses and cleaning, and I'm feeling quite refreshed. Don't need a nap in the afternoon like I had in the past. So if you're thinking of trying it, so far it's been a very positive experience for me. Thanks a lot.
Okay, so we have a 2-year follow-up on that, but I won't play the video again, except to show you this. 2 years later, he went from 2.2 cc to 12.6 cc. Okay? This is what happens 5 years later. He went from 2.2 to 31.8 cc. Okay, so this is ripple effect continues well past the 2-year mark. Okay? We're going to publish this case and present it in May at the American Chest Physicians meeting in Washington, D.C. Here's a patient who said, I don't have to rip off my CPAP mask in my sleep anymore. Okay? She had 20 years of depression, and her psychiatrist knew enough to say, okay, we need to start with sleep to fix your depression. Okay? So once we gave her this appliance, she started sleeping and she started normalizing. And you can begin to lose weight now. She's 17. She ground through her night guard. What's your option? Put her on CPAP? We'll make her another night guard. What's the definition of insanity? Okay. Does she look tired? Does she have a small nostrils? Is she a mouth breather? These are all signs of an impaired mouth syndrome. Okay? What is this? It's called anterior open bite. The tongue doesn't want to be stuck in the throat, so it fought its way out of the cage and created this escape route. Tongue thrusting is actually a survival mechanism. compensating for obstructed airway. That's my opinion. Okay? So what we did was we gave her this appliance. We told her to sleep with this appliance attached to this face mask with a rubber band. And this is what happened in 10 months. You can't tell too well, but 3 years later, we still didn't need to do braces. And the space closed because the tongue thrust stopped. Why would the tongue thrust stop? Airway correction. Good job. You can graduate now. Okay, so her face developed. Okay, so that's why this is an epigenetic redevelopment. When somebody's underdeveloped, you can redevelop them to their genetic potential.
Hi, my name is Riley Hart, and I want to tell you about my DNA appliance. This is my lower, and this is my headgear. I've been wearing all this for about 10 months. First came to Dr. Liao when I was literally just looking for a new mouth guard because I'd grinded holes in it. I was also losing my tennis matches with tennis player and didn't know why. Dr. Liao helped me realize what the problem was, and it turns out I had sleep apnea, my air passageway was 75% blocked, my tongue was too big for my mouth, and it was pretty bad. So this has changed my whole life. 10 months, it's made such a difference. I don't grind my teeth anymore. My whole profile has changed. I sleep better. I have more energy on the tennis court. I'm winning my matches now. And the whites under my eyes don't show anymore. Just great.
Well, in the interest of time, I'm just going to cut it off there. But I want to just present to you the reason why she looked better and felt better was because her airway was more than tripled. Okay, at age 17, she had gone past her growth spurt, but we can redevelop her jaws. That's the point. Okay, here's a 6-foot tiger. This tongue has got a hypothyroid component to it. We need co-treatment in these cases with our medical and integrated colleagues. Okay, look at this. This is edema, mixed edema from hypothyroidism. Her arch should be this wide, then everything can begin to normalize. You won't cure them, but you begin to normalize them. Okay? You had to rule out hypothyroidism before you treat sleep apnea. That's a very important whole health consideration. Okay? Functional medicine would fix this. Okay? Look at this tongue. Look at this airway. The uvula is not visible. Okay? So here's another sign. If they get a big hump behind their neck, if they have forward neck, posterior head rotation, these people are struggling for airway. Maximal extension trying to reach for air. This is an actual patient who came in to see me. The wife says you either go see Dr. Liao or you sleep on the couch. Okay, we gave him this.
Hi, since
And
I
he
started
said that.
using the appliance, I've had more energy. My wife really appreciates it that I am sleeping through the night without snoring.
Okay. We can redevelop someone this way. Which one would have more airway? Which one will make it more easy to fight disease and recover energy? Okay. The more severe your sleep apnea is, the more you're going to die of cancer compared to same people with the same cancer. Biological dentist, what do you see as the problem here? Everybody's eyes go to this, right? Well, I took her from here to here, okay? Because her airway was limited, and everything that she came to see me for went away. Okay? So if not you, then who? Okay? And when the patient has an impaired mouth, they have bad infrastructure driving their health quest. So whenever your mouth does not work, everything will just fall like a domino. Just one thing after another, one dental trouble after another, one medical symptom after another. You try to treat them and they never quite get well. Last slides. I hope I'm getting in the right direction. Don't let this happen under your watch. This patient got proposed a $90,000 dental reconstruction plan. They never once looked at her airway. Okay? $110% overbite. They never asked, is this a 3-foot cage? Why does this patient keep needing one tooth after another? She's got severe tongue tie. She's got broken teeth everywhere. She broke this tooth completely off at the gum line. Okay? So you know about this. And this is the final quiz now. Last case. 59-year-old MD with chronic pain, waking up tired, recurring toothache, and Lyme disease. Okay? What does she have? Does she have good form for good function? Does she have perfectly clean teeth? She always gets perfectly good checkups. Her hygienist never finds anything wrong. Okay? Where does she hurt? Everywhere. What's her airway? That. Okay? So, think about impaired mouth syndrome, and only you can fix this. All right? So I want to thank you for your interest, your attention. This is my contact information. You feel free to continue the conversation with me at the booth, or look me up online, or just email me directly.